Welcome to our medical quiz channel that deals with physical and mental health information.
This quiz is for educational and entertainment purposes only. It is not medical advice, diagnosis, or treatment. If you have health or mental health concerns, please speak with a qualified healthcare professional. Welcome to Quiz-Quizzabay. Test your knowledge about Graves' disease, thyroid symptoms, eye disease, treatment, iodine, and whether Graves' disease can be a disability with this 15-question medical quiz. This quiz is educational and is not medical advice. Question 1. What is Graves' disease? Option A. An autoimmune disorder that can make the thyroid produce too much hormone. Option B. A thyroid infection caused by bacteria in the neck. Option C. A temporary low thyroid condition caused only by aging. Option D. A calcium gland disease that does not affect energy use. Choose the right answer. Correct answer. Option A. An autoimmune disorder that can make the thyroid produce too much hormone. NIDDK says Graves' disease is an autoimmune disorder that can cause hyperthyroidism, overactive thyroid. Question 2. According to NIDDK, Graves' disease affects nearly 1 in how many Americans? Option A. 1,000 Americans. Option B. 100 Americans. Option C. 10 Americans. Option D. 10,000 Americans. Choose the right answer. Correct answer. Option B. 100 Americans. NIDDK says Graves' disease affects nearly 1 in 100 Americans. Question 3. Is Graves' disease a disability? Option A. Yes, every Graves' diagnosis automatically qualifies as disability. Option B. No, thyroid conditions can never affect work or daily life. Option C. It depends on whether symptoms severely limit daily life or work tasks. Option D. Only thyroid eye disease can ever be considered disabling. Choose the right answer. Correct answer. Option C. It depends on whether symptoms severely limit daily life or work tasks. Healthline explains that disability depends on severity and whether symptoms substantially limit daily life or work. Question 4. What does Graves' disease usually cause in the thyroid? Option A. Too little thyroid hormone, called hypothyroidism. Option B. Only thyroid swelling without hormone changes. Option C. No change in thyroid hormone levels. Option D. Too much thyroid hormone, called hyperthyroidism. Choose the right answer. Correct answer. Option D. Too much thyroid hormone, called hyperthyroidism. NIDDK, Mayo Clinic, and Cleveland Clinic all describe Graves' disease as a common cause of hyperthyroidism. Question 5. Which symptom group best fits Graves' disease? Option A. Slow pulse, cold intolerance, and unexplained weight gain only. Option B. Neck pain with fever after a throat infection only. Option C. Fast heartbeat, weight loss, heat intolerance, tremor, and trouble sleeping. Option D. Low blood sugar, fainting and salt cravings only. Choose the right answer. Correct answer. Option C. Fast heartbeat, weight loss, heat intolerance, tremor, and trouble sleeping. Mayo Clinic and NIDDK list rapid heartbeat, weight loss, heat sensitivity, tremor, and sleep problems. Question 6. What is Graves' eye disease? Option A. Immune-related swelling around the eyes that can cause bulging, irritation or double vision. Option B. A cataract that happens only because thyroid hormone is low. Option C. A short-term eye infection that spreads from person to person. Option D. Eye dryness caused only by screen use. Choose the right answer. Correct answer. Option A. Immune-related swelling around the eyes that can cause bulging, irritation or double vision. NIDDK says Graves' ophthalmopathy can involve immune attack around the eyes, causing bulging or vision symptoms. Question 7. Is Graves' disease hereditary or genetic? Option A. No, family history never changes risk. Option B. Yes, it is always passed directly from one parent. Option C. No, it only happens after too much iodine in one meal. Option D. Yes, genes and outside triggers may both play a role. Choose the right answer. Correct answer. Option D. Yes, genes and outside triggers may both play a role. NIDDK says Graves' disease likely develops from a combination of genes and an outside trigger. Question 8. Which factor can increase the chance of Graves' disease? Option A. Family history of Graves' disease or Hashimoto's disease. Option B. Drinking less water during the day. Option C. Having a low-salt diet for 1 week. Option D. Avoiding all seafood since childhood. Choose the right answer. Correct answer. Option A. Family history of Graves' disease or Hashimoto's disease. NIDDK lists family history of Graves' disease or Hashimoto's disease as a risk factor. Question 9. How do doctors diagnose Graves' disease? Option A. Only by checking neck size in a mirror. Option B. Only by asking whether the person feels anxious. Option C. With medical history, exam, and thyroid tests such as blood tests or imaging. Option D. Only by trying thyroid medicine without testing. Choose the right answer. Correct answer. Option C. With medical history, exam, and thyroid tests such as blood tests or imaging. Mayo Clinic and NIDDK describe history, physical exam, blood tests, and sometimes imaging or uptake tests. Question 10. What does a thyroid-stimulating immunoglobulin test check for? Option A. A vitamin level that proves disability status. Option B. A thyroid scan result that alone proves work limits. Option C. A bacteria that infects the thyroid gland. Option D. A Graves-related antibody that can make the thyroid overactive. Choose the right answer. Correct answer. Option D. A Graves-related antibody that can make the thyroid overactive. NIDDK says thyroid-stimulating immunoglobulin is an antibody that attaches to thyroid cells and drives hormone production. Question 11. Which treatment set is commonly used for Graves' disease? Option A. Only antibiotics and cough syrup. Option B. Antithyroid medicines, radioiodine therapy, or thyroid surgery. Option C. Only pain medicine and sleep tablets. Option D. Insulin injections as the main treatment. Choose the right answer. Correct answer. Option B. Anti-thyroid medicines, radioiodine therapy, or thyroid surgery. Mayo Clinic and NIDDK list anti-thyroid medicines, radioiodine therapy, and surgery as treatment options. Question 12. What do beta blocker medicines do in Graves' disease care? Option A. They destroy thyroid cells permanently. Option B. They cure the autoimmune cause in one dose. Option C. They reduce symptoms like rapid heartbeat and tremor while other treatments work. Option D. They replace thyroid hormone for life. Choose the right answer. Correct answer. Option C. They reduce symptoms like rapid heartbeat and tremor while other treatments work. NIDDK explains beta blockers can reduce symptoms such as tremor, rapid heartbeat, and nervousness. Question 13. Which diet-related point is important in Graves' disease? Option A. Very high iodine foods or supplements may worsen hyperthyroidism in some people. Option B. Eating more kelp is always recommended for Graves' disease. Option C. A gluten-free diet is the main cure for Graves' disease. Option D. Avoiding all fruit is required to lower thyroid hormone. Choose the right answer. Correct answer. Option A. Very high iodine foods or supplements may worsen hyperthyroidism in some people. NIDDK says people with autoimmune thyroid disease may be sensitive to too much iodine, such as kelp or supplements. Question 14. Which accommodation may help someone whose hyperthyroidism affects work? Option A. Mandatory night shifts to test stamina. Option B. Support with temperature regulation, breaks, or a chair when symptoms require it. Option C. No restroom breaks during work hours. Option D. Avoiding all medical documentation. Choose the right answer. Correct answer. Option B. Support with temperature regulation, breaks, or a chair when symptoms require it. Healthline notes accommodations may involve temperature control, bathroom breaks, seating or rest breaks based on symptoms. Question 15. What documents may help when applying for disability related to hyperthyroidism? Option A. Only a personal opinion that work feels stressful. Option B. Medical records, diagnosis, symptom documentation, treatments, and doctor visits. Option C. Only a list of foods eaten during the week. Option D. A thyroid self-test without clinician records. Choose the right answer. Correct answer. Option B. Medical records, diagnosis, symptom documentation, treatments, and doctor visits. Healthline says applications often require diagnosis, medical records, symptoms, treatments, and doctor visit documentation. Check your score. 0 to 5, keep learning and try another quiz. 6 to 10, good effort. 11 to 15, excellent score. The trusted medical sources used for this quiz are listed at the end of the video description. You can visit those links to learn more from the original authority sources.
Thanks for watching. Please like and subscribe. Remember, this is not medical or psychiatric advice.